In terms of identifying kids with autism, the first step is really that their primary care physician is attuned to the symptoms or uses a screening instrument to try to capture those kids and at least identify kids who are at risk so that they can refer them to a specialty clinician who can then do a full evaluation. And right now we have some tools that help pediatricians and family practice doctors to look at kids who are at risk. So for example, the modified chat or the M-chat is used in kids who are 18 or 24 months. There's some other measures as well that can be useful screening instruments like the social communication questionnaire and other types of questionnaires that can help any clinician, but especially a pediatrician or a family practice doctor, to at least identify kids that they think might have autism spectrum disorder and then refer them. On the diagnostic side, like when somebody comes into my practice, we're going to use two primary tools to try to better understand if somebody has autism. One's a parent report instrument, and that parent report instrument is where we do an interview with the parent and really go through developmental history and ask specific questions about their symptoms. The other one is a clinician observation tool that allows the clinician to interact directly with the child, to actually evaluate some of the symptoms like responding to the child's name or how they interact socially with the examiner, whether or not they play appropriately. So do they show appropriate imaginative play? For example, do they pick up the telephone and pretend like they're talking to somebody, or play with an action figure or a car or a doll as if they were a self-initiating agent and they were making the car do something that a human would do. And that kind of observation is very crucial to making an accurate diagnosis, because we don't just want to rely on parent report. On the flip side, we don't always just want to rely on observation either, because we might not see the behaviors in the office setting. So we really need both of those tools to make an accurate diagnosis. There's oftentimes a controversy about diagnosis in terms of whether or not we're over or under identifying kids with autism. And at this point, at least, it's very unlikely that we would over-identify kids with autism. In fact, it's much more likely that we would miss a case than we would accidentally give a diagnosis when it wasn't appropriate. There's been some concern that we sometimes miss these high-functioning cases of autism, and there's some validity to that. I mean, I think as the field improves and progresses, I think we'll not only develop biological markers that'll help us to pick up those cases, but we'll also have better behavioral markers. So we'll be able to look more carefully at the behavioral symptoms of high-functioning autism and make sure we detect those kids as early as possible.